All right, so we also want you to look and feel your best this summer overall. Now, if you have spider veins, you might be a little self-conscious about baring your legs this summer. Well, our friend here, he can help you with all your vein issues. Welcome back, Dr. Norman Bein from Vein Specialties Center. Good to see you again.
Always a pleasure to see you.
The numbers are huge. An estimated 80 million Americans over 40 suffer from varicose veins. Talk to me about the relationship between blood clots and these vein issues.
Varicose veins are present in these many people, 80 million people. It's quite a serious concern. It's not just the way they disfigure, the way you look, but rather they're almost always associated with an underlying problem. With ultrasonography, ultrasonography can determine exactly what your problem is. Direct you not to a blind procedure, but rather to a specific related situation that can be treated in the office.
All right, and the risk factors, when we talk about the spider veins in particular, what are the risk factors there?
Spider veins don't always represent an underlying medical problem, and that's why they're considered cosmetic by your insurance people. The varicose veins themselves, however, will be considered surgical by the insurance companies. The spider veins, however, are usually due to hormonal skin changes and so forth. What you're looking at here is our office procedure of getting rid of spider veins with simple laser treatment, and these are very, very painless. People tolerate these procedures very well. Most of our treatments are an hour, and at the end of an hour you've pretty much addressed all of the overlying problems, the superficial problems.
And we said superficial, it is a surface thing, but it can cause some issues that you don't have to deal with. Itching, night cramps.
This picture here shows you the veins that feed what's on the surface. Unless your doctor addresses the underlying vein, which is dealt with by injections at the same time that the spider veins are treated, they're going to come back. So we're not talking maintenance. We're talking about treating people correctly the first time. Look under the skin, go to the deepest part of your problem, inject that area, and then deal on the surface with laser.
And we're going to talk in a minute a number you can call to get free screenings from Vein Specialties, because you need to be screened the right way. Let's talk about varicose veins.
Varicose veins are related to underlying problems. These are hereditary. It doesn't matter whether you sit at work or whether you're on a production line. The standing, the sitting has nothing to do with the production of varicose veins. It's all hereditary. Always, always hereditary, and Medicare and all of your insurance companies recognize this as a surgical problem, and they will cover this treatment with insurance if you wear compression hose for a certain number of weeks prior to any procedure being performed.
And that's an amazing before and after. I mean, you can't tell the difference at all.
Well, the interesting thing is that this is a procedure that unfortunately is still occasionally being done in hospital when it should be done in office. I spent 40 years as a surgeon dealing with these in the hospital with general anesthesia, a lot of pain afterwards, and results less than 100%.
And you're saying it's not necessary?
It's not necessary when this can be done in the office in an hour, and you go back to work the next day.
That is amazing.
Absolutely. It's quite a miraculous change in the treatment of varicose veins and the underlying problems associated with the varicose veins.
All right, we have a number for you to call to find out when there will be in the future free screenings or the services that are available at Vein Specialties. Call those numbers on the screen, 314-993-8233 or 866-626-VEIN. You can visit them online as well at veinspecialties.com. Always a pleasure to have you.
We'll have Maria back next
Coming back from Australia as we speak, a 9,000-hour flight. She's almost here. Thank
Thanks,
you.
Carol.
Thank you very much.